The morning after pill belongs to what is called emergency contraception and is capable of providing a woman with a risk-free means of preventing unwanted pregnancy after unprotected sexual intercourse, or in case of contraceptive failure. There are two main types of morning after pills. The one based on levonorgestrel, a synthetic version of progesterone, a typically female steroid hormone produced by the ovaries. Although the name may be misleading, you shouldn't wait until the next day to take the morning after pill, but on the contrary, it should preferably be taken within 12 hours and no later than 72 hours after unprotected sex. According to some studies, it has a contraceptive efficacy of around 85%. The other type of morning after pill is based on ulipristal acetate, a selective modulator of the progesterone receptor. It is also called the 5-day pill because it can be taken up to 120 hours after unprotected sexual intercourse and has a contraceptive efficacy of 98%, especially if taken within 72 hours after intercourse. How does it work? The morning after pill works by postponing or inhibiting ovulation before it occurs and by delaying the maturation of the endometrium, thus preventing fertilization from occurring. Ovulation is part of the normal reproductive cycle and is the phase in which the ovaries release an egg that can be fertilized by sperms following unprotected sexual intercourse. We know that the egg can live for 24 hours after ovulation, while sperm can survive inside the female body for up to 5 days. Under normal conditions, the menstrual cycle is regulated by the gonadotropin-releasing hormone, GnR, secreted by the hypothalamus, which in turn stimulates the pituitary gland to produce the luteinizing hormone, LH, and the follicle-stimulating hormone, FSH. To find out in detail how the menstrual cycle works and which phases it is composed of, I leave you the video I made above. Thanks to the morning after pill, levonorgestrel binds to progesterone receptors and thus slows down the release of gonadotropins. This process results in the suppression of the normal physiological increase in luteinizing hormone, thus inhibiting follicular rupture and preventing the preparation of the uterine wall for the reception of the fertilized egg. The delay in ovulation means that the release of the egg occurs when the spermatozoa present are no longer viable. In the late follicular phase, on the other hand, when the levels of luteinizing hormone in the blood are increasing, levonorgestrel is no longer able to delay ovulation, unlike ulipristal acetate. Neither the morning after pill nor the 5-day pill have any effect if ovulation has already occurred, as they cannot prevent the fertilized egg from nesting in the uterus. It is therefore not an abortion pill, as it does not interrupt the pregnancy, but prevents it if taken in time. Where can you buy it? The morning after pill, based on levonorgestrel, can be purchased in pharmacies without a prescription for adults and with a non-repeatable medical prescription for minors. The pharmacist may ask you for your identity document to verify your age. As for the 5-day pill based on ulipristal acetate, it can be purchased in pharmacies by women of any age, both adults and minors, without requiring a medical prescription. Like any other medicine, the morning after pill can cause side effects such as nausea, vomiting, tiredness, headache, dizziness, and lower abdominal pain. These are all effects that should resolve within a couple of days of taking the medicine. After taking the morning after pill, menstruation occurs without major changes earlier or later than the expected date. In some women, however, the morning after pill may cause irregularities in the next cycle. If there is a significant delay, 5 to 7 days, it is advisable to carry out a pregnancy test and contact your doctor. If you want to know how the pregnancy test works and how to do it, I leave you the video I made at the top. The day pill is an extreme measure that must be taken occasionally in emergency situations and must never be used as a normal form of contraception.